It's also a Thursday and Healthy Heart Thursdays over the next few weeks. We're going to take you now to Susquehanna Health in Williamsport. We're going to talk a little bit more today about vascular surgery, what a vascular surgeon does, and of course, stroke. Joining me now is Dr. Karla Anderson from the Williamsport Regional Medical Center. She's with the Susquehanna Health Heart and Vascular Institute. Dr. Anderson, thanks for being here.
Thank you very much.
So as a vascular surgeon, talk a little bit about what it is you do on a daily basis.
Well, from a surgical standpoint, we operate on arteries and veins, anywhere from the neck into the abdomen and into the lower extremities. We do a lot of venous work in the lower extremities in people with varicose veins and similar problems. We do carotid artery surgery, which looks to prevent stroke. We operate on aneurysms. Typically abdominal aortic aneurysms. We create fistulas in patients that go on to dialysis.
Now, you did mention stroke, and I understand a lot of the work that you do is to prevent stroke. What are risk factors? What are things people should be on the lookout for to try to prevent it?
That's an excellent question and something that we need to delve on. But the risk factors include high blood pressure, elevation in cholesterol or triglycerides, coronary artery disease, and a strong family history of coronary artery disease, stroke, and vascular disease. Diabetes can contribute as well, and smoking is a huge contributor.
Now, as far as treatments, if you're found to have some of these risk factors, what can you do?
Well, there are multiple medications to help lower blood pressure. But you can be active, and a lot of patients are modestly overweight and need to get on an exercise program to treat that as well. That will also help lower the blood pressure, also help lower the cholesterol and triglycerides, and also help control sugar in their diabetes. There are many medications out for controlling cholesterol and triglycerides, and a lot has to do with diet. And then, of course, there's always just putting down the cigarette and stopping smoking.
All right, a lot of good advice there, certainly to take advantage of. Now, real quick, we'll jump back to vascular surgery. Any late advances that have been developed that we should be on the lookout for?
There are numerous advances in treatment. Most of them have to do with what we call minimally invasive, and that is a catheter and wire-based technique where we use X-ray, contrast, or dye. And we look to treat with balloons and opening up a stenosis, or we actually use these catheters or lasers that actually look to eliminate some of the plaque and narrow the increase the narrowing that's present in the artery.
All right, some good points from Dr. Karla Anderson here at the Williamsport Regional Medical Center. Of course, she's with the Susquehanna Health Heart and Vascular Institute. Thank you so much for being with us.
Thank you very much.
And if you would like to set up an appointment with one of the doctors here at the Williamsport Regional Medical Center or Susquehanna Health, you can give them a call at 570-321-2800 or visit susquehannahealth.org/heart.